When treating PTSD patients, what dose do you start on?
My target dose is typically 0.06 milligrams per kilogram, so that's going to be somewhere between 3 to 6 milligrams. I start at half that dose. That way, if there's any reactivity, if the person has developed sort of an tolerance to their own endogenous opioids, which is a bizarre thing to think can happen, but that's been established, then it allows some time for the opioid system to adjust so they're not reacting. If you look at a lot of the reactions people have to naltrexone, it's not all that dissimilar to, but less extreme, to an opiate withdrawal kind of symptom. So I start at generally half the dose, and that way if they're having a hard time adjusting to feeling their feelings more fully, they get a little bit of time to adjust to that. At the same time, when people have some challenge feeling their feelings more, at the same time, it's also good because to them, they're more in the present, and that's to kind of go back to that first question is, a person's going to feel calmer, they're going to be more in the present moment. A client of mine who just started taking it recently, he noticed he's smelling the smells around the house. He went into a record shop. He could smell the smells there because he's not so hypervigilant that he's looking for threat in his environment. So you're going to feel calmer. He also hasn't had a fight with his wife in 2 weeks, which was uncommon before. So if a person has DID, dissociative identity disorder, formerly what we call multiple personality disorder, one has to go really slow. Then what it's going to end up doing is making transitions less clunky. They may have it might be a little easier to have kind of just a greater awareness of what's going on.